day Fit4D became a company wasn't the day we became a legal entity. It was the day I walked into a doctor's office on a hot summer day, no energy. I'm 159 on a good day, stepped on the scale, I was 129. I'd lost 30 pounds in 3 weeks, I didn't even know it, and I was told by the doctor I had type 1 diabetes. I was 36 at the time. I'd been a runner all my life, I'd already done an Ironman triathlon. There's no diabetes in my family. I was in shock. I was overwhelmed. I live in New York City, checked the local hospitals. They didn't have training classes for another 2 months. There's a lot of information online, but it's not personalized. It doesn't help somebody in that type of situation. And so I was really fortunate to meet a great diabetes educator, a clinician named Cecelia, who met with me every week and took all that information out there and personalized it to me, gave me the support that I needed, the compassion, and most importantly, hope that I could live an empowered life with diabetes. And because of her, we founded Fit4D, where we're about scaling technology, using technology to scale Cecelia. The problem is that 50% of the patients who walk out of the doctor's offices don't fill their diabetes meds, or they drop off in the first 6 months. It's a huge problem, not only for them, but for society, who bears the cost. And why don't they do it? Because it's overwhelming, because they're in fear. How can they afford it? Do I want to inject myself? Am I a failure? There's so many things that are going through their mind. We really need to help them through that. So our moonshot, as Steve calls it, is to improve the health of everyone living with diabetes. There's 30 million in the US, there's over 400 million in the world. To give them that personal companion, that diabetes expert clinician who's able to give them the support and that same compassion. You can read the bios of our phenomenal team on our website. The CEO of Blue Cross North Carolina just joined our board of directors. We have a great advisory board. But let me tell you about the culture about our company. We use something called Gazelles, also known as Rockefeller Habits, and our culture has 5 parts. We're very results-based. We get stuff done. We're very efficient. We're continuing to always reprioritize things. We work as a team, which not only is collaborative, but we got to give people energy, right? If somebody worked till midnight, let's really be extra nice to them next day. We're compassionate to our patients, to ourselves, and for our clients. And most importantly, we go the extra mile. And we live that culture every day. We make decisions by it. And so you can read the names and bios, but know who we are. We actually live that culture. How Fit4D works, everyone is different. Here's an example of a diabetes educator working with 2 different patients. One is tech savvy, one is not. The one who's not tech savvy is going to get a lot more of telephonic intervention. The one who is going to get email reminders as well as text and invitations to online support groups. Another difference, everybody works on different schedules. The mom who's taking care of the kids can't focus on their diabetes till the kids are in bed. So our diabetes educators work 6 days a week, 8 a.m. to 8 p.m. across 3 time zones. Makes a huge difference. And what is bugging the person the most about their diabetes? One person who's dealing with a side effect of the medication, we have to take care of them differently than someone who's in denial about their diabetes. So the whole engagement is very personalized. What's different about Fit4D? We are the largest employer of diabetes educators in this country. These are clinicians. These are dietitians, nurses, and pharmacists who have 2 years of advanced training in diabetes under supervision and have passed the national exam. They're behavior change experts, and we've enabled them to scale by leveraging our technology platform. It's working. We're delivering over 3 times ROI. We have 2 sets of clients. We have pharmaceutical and medical device companies where we're solving for initiation and persistency to medication, and we have health plans. And third-party companies have measured that we're delivering a 3 times ROI for our clients. We've demonstrated over 20% adherence and savings over $380 per year for our clients. We're running at a 5 million ACV run rate. We've been growing 80 to 100% year over year. In the last year alone, we've signed Humana, and they've already expanded the work with us. Blue Cross Nebraska has been a client and an investor. Health First was our first health plan client. We just went live with Blue Cross Care First in Maryland last month, and we received word last week that we just won a very competitive bid with another Blue Cross plan. So we're on a roll. And as great as we're doing, we're touching maybe 100,000 people in the country where there's 30 million people in need. And we need your help. We need partnerships. And so we have to act now. And there's people in this room, whether you're at a health plan or you're an investor, let us help the rest of the 30 million, and then let us help the rest of the world. Join us as we improve the health of people with diabetes. Thank you.